Good evening. So this is Dr. Karan Saraf. I'm a practicing nephrologist at Apollo Excel Care Hospital, Guwahati, Assam. So today we'll be talking about do's and don'ts of dialysis. Dialysis is an advanced technique that helps the severe kidney disease patient to live an active life. In dialysis, a machine filters the salt, waste, and fluid from the blood when the patient's kidney are not in a good condition and unable to perform their function. So, a well-performed dialysis can prolong the life of a kidney failure patient, and we can now expect that the patient can do well even on dialysis for a long period of time, say 8 years, 10 years, 15 years, so on and so forth. The only thing to be taken in consideration is a good diet to be followed, a regular cardiac checkup, and a regular infective screening. Now, I'll take you through some do's of dialysis. So the number one thing is you should take your medicines regularly. You should meet the nephrologist once in a while, get your blood workup done, and get the medications adjusted. So your prescription would usually entail some antihypertensives, some sugar medications, some medicines to alter your calcium and phosphorus. Very importantly, you'll be put on some erythropoietin injections, which will maintain your hemoglobin levels. So it's very important that we take medicines on a regular basis. The drug treatment should not be stopped even if the patient has started to feel well. Complete treatment therapy to prevent complications in the future. The two point I would like to stress upon is we should be consulting our doctors. Most often, I see patients are dialyzing in the periphery and they feel so good that they hardly come to the doctor for a follow up checkup. And then one day they'll end up in some complication and they lose and they succumb to their illness. So, the most important thing is you should consult your nephrologist once in maybe 3 months, get the blood workup done, and get your medications adjusted. These consultations are important to look into your nutritional aspects, to look into your BP control, to look into your sugar control, to look into your bone health. Bone health is an often ignored area in a dialysis patient, and gradually on dialysis you develop weak bones and you tend to develop fractures very quickly. So that is one area we need to focus on. And if you have any difficulties or if you're being prescribed some drugs which are not related to kidney, even then I would suggest you should consult your nephrologist and then only take those medications. Now, number three, have a healthy diet. A balanced and a healthy diet, the role of which cannot be emphasized enough. And it's a basic misnomer that once a patient is having a renal failure and put on dialysis, you should be restricting your diet. No. So we should be taking, in fact, a lot of proteins because dialysis is a catabolic procedure and you might lose a lot of muscle mass. So you should be having 5 portions of meals in a day in equal quantities. You should have starchy foods such as potato, whole grain bread, rice. You should be having a lot of protein, maybe around 1 to 1.2 grams of protein per kg per day. So if you are a 50 kg man, you should be having about 55 to 60 grams of protein, which is quite a bit. So foods like beans, fish, eggs, pulses, meat, these are good for your muscle building. Exercise regularly. So a little bit of exercise goes a long way in improving your dialysis, your heart condition, and a good heart, really prolongs the dialysis life. Now, what are the don'ts of a dialysis? The don'ts are that you should be having some basic lifestyle control: no smoking, no tobacco, no alcohol consumption. Your salt and sodium intake should be very low. You should not be having a low sodium salt because these salts are high in potassium. You should be having a normal salt but less in quantity. And this will reduce your blood pressure and it will also help in restricting your weight gain so that you don't feel breathless between the two dialysis. Vaccination is the most important thing to prevent any infections. We should be having a good amount. You should be having the vaccines to be done regularly. So, not getting vaccinated is something which is not recommended. Influenza vaccine, pneumonia vaccine, hepatitis vaccine. So, these are the vaccines which your nephrologist should be prescribing, and you should be getting those vaccines in timely manner. You should not be having too much of water intake during the dialysis because if you drink a lot of water, your kidneys do not produce enough urine to flush out that water and you develop a volume overload. You go into a breathing difficulty. The other thing is you should not be, some people have a common misconception that you cannot take painkillers while you are on dialysis. So during dialysis, your kidneys are not really functioning properly. So there is not much kidney health left to be preserved. So if you're suffering from any severe pain, you can take painkillers. It's not contraindicated. Severe kidney diseases damage the kidney and the need for dialysis arises. And this procedure helps you to perform your daily activities. Though dialysis is not the complete solution, and if you want to have a better quality of life, the only way forward is a renal transplant. A renal transplant is the best form of treatment a kidney dialysis patient can receive. So you should talk to your nephrologist and maybe get a evaluation done whether you are a candidate for transplant. Thank you.